Now we're going to move on to pre-admission testing. I really like this program we have at St. Joseph Hospital because it makes your day of actual surgery much, much easier on you. You should receive an appointment time from your surgeon's office for your pre-admission testing. You'll come on into the hospital on that day. You will get registered for your day of surgery that day, and we will also get your electronic health record already so that it will be much smoother for you when you actually come in for your surgery. You will meet with the pre-admission testing nurse. She will go over your height, your weight, your allergies. What medications do you take at home? What is your medical history? What is your surgical history? Make sure all of those things are up to date in our computer system. At that appointment, you're also going to meet with the anesthesiologist. They will probably ask you a lot of those same questions, but they're going to hone in on a few other things to make sure that your anesthesia goes very smoothly. If you're a person who has problems with postoperative nausea and vomiting after you've had surgery before, this would be the time to tell them that. There are a lot of things that anesthesiologists can do to help prevent that from happening, so it's a great time to mention that. You will have some blood work likely drawn at this appointment, probably an EKG, and they're just going to get your whole chart ready for that day. Your pre-admission testing nurse is also going to go over your home medications pretty closely. They're going to let you know what medications to take the night before surgery, the morning of surgery, and which ones not to. It's worth mentioning at this point right now that your neurosurgeon's office will probably direct you to stop taking, of course, any blood thinners about 10 days prior to surgery, or any NSAIDs, non-steroidal anti-inflammatory medications, about 10 days before surgery. If you're that close to surgery and those medications have not been discussed with you by your surgeon or their office, please call their office just to clarify anything that you should or should not be doing. The pre-admission testing nurse will give you this Blue Express Pass. One of the things she will put on this Blue Express Pass is the medications you should take the night before or the morning of surgery, just to help you keep that straight. Other things that they will put on this Blue Express Pass, what time you should arrive your day of surgery, and all the other little notes that they think are pertinent to your situation. They will also direct you on how to use these scrub packets. These are very important to use. We do carry bacteria around on our skin just naturally, but they do want to reduce the risk for infection for surgery. So the night before and the morning of surgery, your pre-admission testing nurse will direct you how to use these. We do ask that after using them, you do not put any lotions or powders or anything like that on your skin. We want as clean a palate for your surgeon as possible. As I mentioned, your pre-admission testing nurse will give you time to go ahead and come on into the hospital on your day of surgery. Be aware, though, that sometimes schedules change, and the evening before your surgery, your nurse may call you and just let you know if any time changes have happened or not. Also, very important, before your surgery at midnight, nothing to eat or drink after midnight, especially the anesthesiologist. Take it very, very seriously. A sip of coffee, eating a lifesaver, that will cancel your surgery, or at a minimum, push you back about 6 hours from your original schedule. So it's very important that you stay nothing to eat or drink after midnight, with the exception of any medications that you're cleared to take that morning. You can get those down with a small sip of water, but aside from that, please don't do that. We don't want your surgery to get disrupted. It is, however, okay to brush your teeth. There's not a problem with that. If you are a smoker, please do not smoke on your day of surgery. Nicotine can do funny things to our bodies in conjunction with anesthetic medication. Same thing with vaping. We ask people not to vape on their day of surgery either. If you are diabetic, please make that clear to your pre-admission testing nurse. If you take medications usually to lower your blood sugar, we may have you skip that on your day of surgery because you will have had nothing to eat or drink. And I can tell you, we would rather deal with a high blood sugar and treat that than a very, very low blood sugar. So please let anyone on your pre-admission testing appointment know if you are diabetic. Also, if you take a beta blocker for heart conditions or blood pressure, you will likely be directed to take that on your morning of surgery because it is protective of the heart as you go through anesthesia. If you have any questions about medications, please bring it up at the time of that appointment.